Hello, dears, and welcome to Al-Hussaini Virtual Lab, Pathology Talks, Tips, and Practical Tips. What I'm going to be sharing with you today is a nice example, courtesy Dr. Imam Hijazi. This is a case of solitary fibrous tumor of soft tissue. So this is a case of a 34-year-old female patient who presented with a well-circumscribed 12-centimeter thigh mass. And as you can see here from the low power magnification, the tumor has both hypercellular areas and hypocellular areas. And from the low power magnification, there isn't much in the way of pleomorphism. Another focus of low power magnification would reveal these ectatic, very dilated vascular spaces, another subtle clue to the diagnosis, and again, not much in the way of pleomorphism. Now, on higher power magnification, as you can see, the tumor cells lack pleomorphism. They are monotonous. They are sometimes oval in shape, sometimes spindle in shape, some collagen in the background. The vesicular nucleus, no evidence of a prominent nucleolus. Again, not much in the way of a good clue to the diagnosis. Another more cellular area showing the exact same appearance of the tumor cell nuclei, where we have the monomorphic cells with vesicular nuclei, inconspicuous nucleoli, and then some hint into collagen in the background, as we can see here, the pink material in the background. Now, surprisingly, about this is very well described, we encountered some tumor giant cells scattered in some foci of the tumor, in addition to the myxoidish background that is seen in some of the foci, but yet the tumor cell nuclei are exactly the same. So whether this is hypercellular area or hypocellular area, you would still see the same appearance of the oval to slightly spindle cell nuclei, and don't let those multinucleated giant cells shy you from making the suggestion for the diagnosis of solitary fibrous tumor. Now, again, some hypercellular areas, some hypocellular areas with myxoidish background, but then we started to see mitosis, mitotic activity. And counting mitotic figures, there was almost 4 mitoses per 10 high power field in the most active areas that were encountered. So this is another mitotic figure. Another important clue to the diagnosis is the presence of hyalinization to the tumors, to the tumor vessels. And remember, hyalinization would mean in general that the tumor is long-standing. It has low malignant potential, let's say. And again, more the same appearance of the tumor cell nuclei here. These are spindly, sometimes they are oval, slightly stellate cell nuclei, but in general, they retain the same morphologic appearance for the chromatin, as well as the lack of atypia and hyperchromasia. Now, the CD34 is a generic marker that can stain a number of tumors, but in this instance, because we had solitary fibrous tumor in the differential diagnosis, CD34 showed this beautiful positivity. But what really is pathognomonic of solitary fibrous tumor is immunohistochemical positivity for STAT6. This is a nuclear stain, and we should see strong and diffuse nuclear staining in the tumor cell nuclei in order to render a confident diagnosis of solitary fibrous tumor. Is actually STAT6 is the most robust ancillary technique that is utilized for confirming the diagnosis of solitary fibrous tumor. Another area where we had the tumor giant cells, and the tumor giant cells also stained positive with the STAT6, meaning that the tumor giant cells are part of the tumor. They belong to the same cellular constituents as the tumor. Now, remember that solitary fibrous tumor is characterized by an intrachromatic chromosomal on chromosome 12 along the long arm at Q13, intrachromosomal inversion and fusion between NAP2 and STAT6, resulting in activation of NAP2 and thus the proliferation of the tumor into the characteristic solitary fibrous tumor. Now, recently, it has become important to assign risk stratification in terms of the chances for potential for recurrence as well as metastatic capacity for the tumor or malignant behavior of the tumor. And the most commonly used is either the 3-variable model or the 4-variable model that incorporates the patient age, the mitosis per 10 high power fields or per millimeter square, a tumor size in centimeter, and in the 4-variable model, we include tumor necrosis. Now, aligning these features into our tumor, our patient was 34 years of age, so the 3 and the 4-variable model, she will be assigned 0 score. For the mitosis, the mitotic figure in the tumor, the highest areas of mitosis contained 4 mitotic figures per 10 high power fields, so a score of 2 is assigned in both models, and the tumor size, remember, it was 12 centimeter, so it is again a 2 in both models. Now, for the tumor necrosis in the 3-variable model, we do not assign, it's not part of the criteria for stratification of the malignant potential, whereas in the 4-variable model, it is added as one of the variables, and it is assigned number 1 score 1 if it has necrosis. Our tumor did not show necrosis. So the final actually score or point for our tumor, whether this was on the 3 or the 4-variable model, was 4 points, meaning that the tumor carries an intermediate risk for recurrence and malignant malignant behavior. So for the final diagnosis in this case is solitary fibrous tumor of soft tissue of intermediate risk. Remember that the clues to the diagnosis are the hypo and hypercellular areas. Remember that the tumor cell nuclei usually lack features of malignancy. They are usually monomorphous, vesicular nucleus, inconspicuous nucleoli. Remember that myxoid changes and multinucleated tumor giant cells can be part of the tumor. Remember that hyalinization of the vessels are excellent clue to the long-standing feature of the tumor and thus to the, in a way, malignant potential of the tumor. Remember that STAT6 immunohistochemistry is the most important, robust ancillary technique to confirm the diagnosis. And remember to assign risk stratification similar to just tumors whenever you encounter a case of solitary fibrous tumor in the soft tissue, regardless of the location. I hope you find this tip useful in your daily practice. Thank you.